cautious optimism as Italy shows initial signs of crisis slowing. A slowing rate of hospitalizations requiring intensive care may mean the peak of Italy's crisis is within sight. Initial signs of a slowdown in Italy's coronavirus epidemic, the world's deadliest, have started appearing across the country in recent days, say officials, providing a beacon of cautious hope to other Western nations where authorities are implementing similar containment strategies, but where the infection rate is still growing fast. Following a national lockdown that began on March 10, Italy has become an international litmus test to understand the dynamics of the virus's spread, and the relative success of strict measures to stem the contagion. Though statistics vary, many hard-hit countries could be around 3 weeks behind Italy in their domestic infection spread. On Thursday, Italy announced that the number of deaths here had risen by 760 in 24 hours, to 13,915, as new cases grew at a steady rate by 4,668, against the previous day's 4,782, to a total of 115,242. Similar rates of growth in total cases have been recorded in Italy over the past 5 days, shifting between a maximum of 5.6% and a minimum of 4%, showing a tentative steadying of the contagion curve. Silvio Brucifero, president of the National Institute of Health, told a press conference on Tuesday that the country seemed to be arriving at a plateau, showing that the movement restrictions were working. He also hinted at the possibility of having reached a peak in the contagion. Although experts mostly agree there are some initial signs of improvement, they still warn that official numbers could be failing to provide a clear picture of the overall situation. Technically, the peak is the day when the highest number of daily infections is reached, Nino Cartabellata, a leading Italian public health expert, told Al Jazeera. After March 21, when Italy had a high of 6,500 cases, we witnessed a decrease. We are now in a sort of a plateau, where numbers still go up and down, since they also depend on the number of tests conducted on a daily basis. This might last up to 3 weeks, when a decrease should begin. But based on the different virus transmission rates seen across Italy's varied regions, and with discrepancies in testing policies, Cartabellata says discussing a contagion peak in Italy was like talking about a fabled phoenix. The number of infected patients, announced, depends on the daily changes in the number of tests, meaning this figure cannot be taken as an objective measure. It is like looking through a keyhole that keeps constantly changing in size, he says. Experts say the number of infected people in the country is certainly higher than has been announced, as the vast majority of tests have only been conducted on people who have been hospitalized, leaving infected citizens with no or few symptoms uncounted.